And for our third presentation for this early part of our morning, we're going to be talking about delivering health benefits at the interface of public lands and community wellness. And we have three presenters. The first is Joe Flower. He serves as a Presidential Management Fellow for the U.S. Forest Service in the Lake Tahoe Basin. Prior to joining the Forest Service, he served our national parks while working on wildlife and physical science projects throughout the western United States. We also have Christy Gavigan. She's been practicing nursing since 2005 at Barton Hospital, where she works in emergency, infusion, and sports medicine. Her experience includes the care and treatment of the chronically ill, mental health, and orthopedic patients. And she is currently serving as the Community Outreach Coordinator for the Barton Health Center of Excellence. And we have Dr. Stephen Banner. Is that correct? Okay. He is a practicing orthopedic surgeon and the medical director at Barton Memorial Hospital in South Lake Tahoe. Dr. Banner also enjoys teaching both as a fellow at Lake Tahoe Sports Medicine and as a clinical assistant professor at the Nevada School of Medicine. So please join me in welcoming these folks for our next presentation.
I want to personally thank Florence, because we quoted her work as well as others to validate this program. She's done a lot of fine work that we needed, and we did identify the need in our nation. I think there's little debate that there's a crisis in medicine currently. We have sicker patients, there's an epidemic of obesity, diabetes, hypertension, cardiovascular disease, and equally troubling is the increase in mental disease, depression, anxiety, post-traumatic stress disorder, as well as attention problems. And to date, most of our, the way we have addressed medical issues has been intensive on technology, intensive on medications and procedures. But we really have to change our mindset from treating disease to promoting wellness. And I don't think anyone could describe it any better than Florence did just recently. So the question comes, can I prescribe nature as medicine? And I believe I can. I think everyone in the room has experienced what was described, that awe, that good feeling you feel. But how do we go about doing that? Can we get this experience and bring it back as a prescription that will be good for the patient, good for the community, good for our nation? So we looked at it. Is there any scientific evidence? And as Florence described, there is. Japan has adopted it into their national healthcare system for over 30 years because of the evidence. It can decrease your stress, blood pressure, cortisol levels, heart rate, and cure up to, or help treat up to 15 diseases that are stress-related. It can improve your concentration and memory. So we all would like that for improved work function. It also can help with attention deficit disorders in our children population. Interestingly, though, it can even affect your immune system. Natural killer T cells in your body can help fight infections as well as combat cancer. There's an increase in up to 40 to 50% in those levels with just some exposure to nature. She also described some of the brain benefits. Functional MRI shows a decrease in depressive rumination centers and an increase in empathy centers with exposure to nature. It's all good. So how do we do this? Who could benefit from this? Clearly, everyone can benefit from this. It's cheap, it's effective, and everyone has access to it. So I encourage this to all of my patients. But in our community, we identified several populations that were at particular risk and had difficulty experiencing this. These are specifically the chronically ill, who had limitations on mobility or adaptive devices or oxygen tanks. The recently injured patient, who was fearful of getting out, potentially getting re-hurt. The at-risk youth, too much screen time or attention deficit problems, they're clearly at risk. And also we identified as our minority population. Maybe there was a cultural barrier to experiencing this benefit. So we came up with this idea of a partnership. This partnership would combine the biggest healthcare provider, our hospital community, with all of the healers, the physicians and nurses, and combine that with the biggest public land manager, the U.S. Forest Service. So how could we deliver this health benefit into an outdoor environment and use these as healing centers? So what we did is we partnered, we provided patient selection, provided education and support, not just for healing, but also to help with the Forest Service, and then engage them in creating these outdoor treatment centers that were appropriate to these specific populations. With that, I'd like to turn it over to Joe Flower, our Forest Service representative.
Thanks, Steve. So diving a little bit deeper into the partnership we kind of devised is based on three core components. The first, and kind of at the heart of the partnership, are these community wellness outings that take place on public lands and specifically target the at-risk populations that Steve mentioned. The second component is this notion of partner-driven accessibility evaluations at our developed recreation sites. How can we use partner feedback to drive improvements in our developed recreation sites? And then lastly is preventative medical training for Forest Service employees that work in high risk and injury-prone positions like wildland firefighters, like backcountry rangers. So let me start with a little bit of the overview of the wellness outings. So really at the heart of this partnership are these community wellness outings for folks in our community in Lake Tahoe that are living with challenging circumstances, folks with chronic illness, folks that are recovering from major surgery, post-surgical knee replacements and things like that, and at-risk youth. So we kicked off our first wellness outing last fall with a wellness walk for folks living with chronic illness. We held this at the Taylor Creek Visitor Center in Lake Tahoe, and it was remarkable to see what happened. You know, having Barton's medical professionals on hand really was the mechanism that allowed these folks to gain the confidence they needed to get out of their house, overcome isolation, and connect with others that are living with similar diseases. And bringing the Forest Service in provided that interpretive piece where we could support the logistics, help identify the outings, deliver a message about the connection between community wellness and ecosystem health. We followed that wellness walk up last fall with a post-surgical moonlight snowshoe along the south shore of Lake Tahoe. And this was directed for folks that were recovering from full knee replacement surgery, hip replacement surgery. And we found, again, that these supported outings, bringing the public land manager for the interpretive piece, bringing in the support network of the medical professionals, allowed people to gain that confidence they needed to venture out of their house, overcome fear of regaining their movement and mobility, and really celebrate their recovery with others that have gone through many months, if not years, of recovery to regain that mobility and freedom. The last wellness outing we did was pretty recently, was directed for at-risk youth. And this was specifically targeted to Barton patients that were young people struggling with either emotional or behavioral issues. And it was a chance to get these kids out on public lands, to have them unplug from technology and connect with the natural world. We taught them a little bit about an active stream restoration project that we have going on in the Lake Tahoe watershed that's working to improve lake clarity and enhance wildlife habitat. Maybe just as importantly, though, this was an opportunity for these kids to simply be active in and curious about the natural world. So the second piece of the partnership really evolves around accessibility evaluation. And the idea here is to tap into the unique perspectives of these wellness participants to collect some critical feedback on the accessibility of our developed recreation sites. The idea would be to collect that feedback and use it to identify improvements to our developed recreation sites, and then leverage the partnership and the funding we have to make improvements to those sites and kind of create this positive feedback loop where we're breaking down barriers to accessibility on the national forest. The last kind of core component of the partnership revolves around preventative medicine, and this is specifically directed for Forest Service employees that work in arduous positions like wildland firefighters, backcountry rangers. Barton has come on board and worked with the Forest Service to host wellness clinics to teach wildland firefighters how to take care of their feet, how to prevent common injuries that happen on the fire line, and prevent the loss of firefighting capacity and keep folks on the fire line. One more. There we go. And then this month we have another wellness clinic that's going to be put on for our backcountry rangers, having Barton's medical professionals on hand, teaching folks how to take care of their bodies during these long summers of being in the backcountry, how to recognize emergency medical situations where they need to say, maybe I should get out of the backcountry, you know. So that's kind of a snapshot of the partnership, and I wanted to turn it over to Christy Gavigan to talk a little bit about how we got the partnership off the ground and how you might apply the model in your work.
Thank you, Bill. Hi. You might wonder how we started this partnership. We applied the collaborative model to our partnership. Some of the first steps we took were identifying the need. And every community has populations at risk, and every community has public land that needs to be developed, maintained, and even appreciated. We identified the partners that had like-minded values or mottos. For example, the U.S. Forest Service that Jason mentioned, caring for the land and serving the people. And Barton Health, engaging the community to enhance health and wellness. We also, let me just slip back here. Some of the initial outcomes that we experienced was cultivating community. And we felt it was best that you met some of our participants via video. This is Mike. Mike had a hip replacement that was complicated. He was housebound, afraid, felt isolated, and was actually suffering from depression. He wanted you to hear how he felt about his experience snowshoeing. So Mike, I initially called Mike at home and invited him on this snowshoe outing. I left a message. There was no response. 2 days later, I received a response from his wife saying Mike would not be able to attend. The night before the outing, he calls, "Christy, I really, really want to come." When Mike was out there, he experienced increased mobility. He increased the ability to make friends from strangers. He no longer felt isolated and alone. He cultivated his own community. We also experienced participants that were able to be inspired by their outing. And I'm trying to get to the creating the inspiration bubble because I'd like you to meet Ron. And Ron is one of our infusion patients. He is suffering from rheumatoid arthritis. He is also suffering from an oxygen-dependent lung disease. Ron is a musician by profession. He has not been in the studio for over a year. After our outing, he got back in the studio and he had this to say.
You know that I was so inspired by that afternoon, that walk, that beautiful walk, that I went back into the studio and I was motivated to write a song about that afternoon. So I'm in the middle of writing a score, and this is just a small portion of it.
Some of the mutual benefits that we received, yes, we were out there. We saw our patients experience joy, develop communities, be inspired, be motivated, get motivated to get back outside and appreciate public lands. But what we didn't anticipate was the mutual benefits that the volunteer providers experienced. We often find ourselves providing care in sterile, controlled environments. We often find ourselves at our desks, overwhelmed and burdened by paperwork that is necessary to complete our jobs. But where we really want to be is outside. We want the joy. We want to experience community. We want to be inspired, not only ourselves as providers, but we want to do it with our patients. This outings program allowed this to happen. So in closing, to help ease the national healthcare crisis by promoting wellness in public lands, This model must be incorporated into our national healthcare model. By applying a partnership like ours with Barton Health and the U.S. Forest Service, it shows that you too can apply this partnership with your organizations, with your local healthcare system, and make it happen. We thought it was important too that you heard the words from Carol. Carol is a 75-year-old knee replacement patient. She's 2 months out. She's never been snowshoeing. She's never done a moonlight walk along the south shore of Lake Tahoe. She's never worked on range of motion with her knee by me holding a branch down. These are her words. Public lands are special treasures and not to be taken for granted, but appreciated and respected, not only for their beauty, but for their power to heal. The land is truly a gift that must be regifted to each generation. This program enabled me to step out of my comfort zone, make new friends, learn the history of the site from the ranger. Lucky me, Carol Bemis. So it is our hope, Steve and Joe, that you are not only bystanders, but you are inspired by our story, and you can take our model and apply it to benefit your community. Thank you.